Hi, I'm Dr. Rod Rourke. I'm a plastic surgeon in Dallas, Texas, and I want to share with you our expertise on the use of fresh frozen rib grafts in primary and especially in revision rhinoplasty and in all areas. We're going to cover several aspects. How to carve the cartilage for both columella struts, septal extension graft, dorsal onlay spreader grafts, extended alar contour grafts, and then how to utilize grafts, especially fresh frozen grafts, and if there's any oppositional contouring or concavities or warping, you can use the power of oppositional suturing to make them straight and to make them not only very purposeful for all of these things that I talked about, but to make them look great both short and long term. So join us when we go through these carving and these suturing techniques. Okay, so some basic principles here, of course, of warping, and every cartilage graft eventually does warp, but you can see if a cartilage graft has some yellow in it or it's a partial ossification, it stays pretty straight, okay? But if it's a little more white, it tends to curve. So this is yellow, much straighter, and this is curved, okay? Because it's a younger cartilage. So the goal is to try and not use these kinds of cartilages unless you have to. But if you have it, you can take it and use two that are actually somewhat warped, that have some warping, which is normal, and you push them and you put them together. So what you can do is you can use the opposing forces to make them straight. And that's exactly what we're doing here. So use the opposing forces and make them straight. And that's exactly what we're seeing here. And the way you can solidify that is you can put them on this silicone sheet like this, and then bring them up, and now you can use these and use multiple sutures to actually get them in place. So I'm going to demonstrate that with a horizontal mattress suture, and we're going to just put them into place. Usually it's 3, and you put them into place, and it works quite nicely in this area. Thanks, Mike. And then we'll suture them into place. If there's any oppositional straightening that needs to be happening, then you can actually do this. You can hold one side straight and then bevel it, so then you can put your suture in so that this will allow for correction of that. It's brilliant, and this is really, you're actually using the power of both, but you're using, so like if I want to straighten this out more, I'm going to hold this into place. I'm going to put it in place, and then I'm going to suture it into place. And that's what I'm going to do here. So So now we have a straight piece of cartilage here. It's perfectly straight. It was not before. And then what we'll do is we can now make this into whatever we like. If it's going to be a dorsal onlay graft, then I will make it keel shaped. So I'll proceed to do that. we'll make it keel shaped, and we'll usually have the narrow part is the one that actually goes to the dorsum, and then the other one goes distally. So it's usually keel shaped. And what I do often with this is I actually bevel it too. So I'll bevel it, especially if the patient has thin skin, I'll bevel the edge. So now we have the keel-shaped process in place here. And that will work well for the dorsum. And so it can be keel-shaped, it can be narrower. Like I said, at one end, this will be the one end that we do that, and then you can balance it to the other end. So this would be going onto the dorsum of the nose right here. Now, if you want to make this into a Kyle-Muller strut, you can actually do that as well, and you can do, in this case, if this was a Kyle-Muller strut, I would then make this more like a Bowie knife, where basically you're shaping it like a strut. So this would be a Bowie knife configuration. So it would be, this would go into the base of the Kyle-Muller, this comes up between the feet of the medial crura, this comes to the infratip area, so that's a Kyle-Muller strut. This happens to be a straighter piece, and this is not uncommon, and there's a concave piece. So put the two together, sandwich them, and it really will help to put them together and suture them into place. Again, we'll use this silicone sheet, and once we've done that, we'll bring them out and we'll show them. So, and again, we'll do the suturing. But again, if it's not completely straight, you can actually, again, apply uneven opposition with your forceps and then suture it into place. So now you have a piece of cartilage that is very versatile and straight. So what I'll do with a piece of cartilage like this that is that I would say still needs a little bit more help, and another suture, and then it'll be straight. And that's the beauty of doing this oppositional suturing with pieces of cartilage that are not necessarily perfect. And rarely are cartilage grafts perfect. I mean, I use this a lot in the dorsum of the nose, but this will be to demonstrate this for a septal extension graft. Now, what you can do here is I can design it, and again, when you're doing a septal extension graft, you have a broader base, and one side is more of a Bowie knife straight, and the other one is straighter. That's the one that's going to be more cephalic. Let's just say this is the septum. I will place the septal extension graft between this. And when you do it between the septum, then you can put sutures into place. And then in this way, if you want to just increase tip projection, you put it at 90 degrees to the anterior septal angle. If you want to rotate the tip up, you put it higher. And if you want to rotate the tip down, like we've done recently, to decrease the tip projection or to lengthen the nose, you put it in this way, and you put sutures in this area. So it's very versatile. So you're again using the power of suturing, oppositional suturing, to make a septal extension graft. We've already shown how you do it for a dorsal onlay graft. And those are the two big, powerful techniques you can use for correction of any type of cartilage warping. Alar contragrafts are also something that I do a lot of, but alar contragrafts are very, very refined, because they need to be about 1 or 2 millimeters thick. And here it's okay to actually have a little warping. I actually don't mind warping on an extended alar contragraft. They have to be both very pointed, spear-shaped. So this is very, and I don't mind having a little warping. I like that actually. So you've got paired alar contragrafts, extended alar contragrafts. These go all the way to the alar base, so you've got two nice ones here. And then this goes all the way to the alar base. If this is the alar base, it goes all to the alar base, and then this goes to the soft tissue triangle. And then if you need to, you can taper cut it right as it approaches the tip area. So nice alar contragrafts, and these are okay to be this way. I like them like that, so these are nice. So these are alar contragrafts. So alar contragrafts, you know, we've got Calamar struts, we've got the septal extension graft that we've shown. These are all excellent. These are the workhorses, and we've already shown you the dorsal onlay graft, which is great. And of course, it's ideal if both of the grafts are straight, but if they're not, always put them in opposition and then suture them together like we talked about. And then you can carve them. And I always carve them after I've done my suturing. So just to show you the carving I like to carve them together as a unit. You always carve cartilage grafts as a unit if you're laminating them. Don't do them separately. So that just shows that principle of unit carving. So one other graft that is very versatile is a spreader graft. And it's okay if it's, again, concave or convex. You can cut the graft in the middle, and then I like to taper both ends slightly, and the superior tapered end goes more cephalic and in this area. And so if these are my two spreader grafts, they're placed on either side of the septum. So when we place them on either side of the septum, and I'm going to give you, this will be a rendition of a septum, and I'm going to make this a little straighter. So if I have a spreader graft and I'm placing them high on either side of the septum, then what I'm going to do, if this is the septum proper here, I'm going to place them concave contact and concave contact. So it's going to be concave, concave, and then if this is the septum, then I'm going to bring them together, and I'm going to use my graft again. I'm going to use a 25 gauge needle. This will be in situ, and this is just like, again, we're approximating what it would look like in the nose. So I'm going to be using, so that middle portion is the septum, and I'm going to I always recess it below the septum anyway, and because you want to not widen your dorsum. So I'm going to do that and put this into place, and then I'm going to put in sutures, and I'm going to put in sutures here again and again. This is simulating how we would do this in the real patient, because you want to put the grafts that they're again concave to the center, and that way they'll be straight. So these are the spreader grafts between that are really recessed between the septum, which is higher. And in this way, you can actually use these grafts almost uniformly and keep them straight. So it's just like any graft, even a septal graft. You know, there'll be some tendency towards warping, but always put the concave toward the midline and then suture it into place. So now we have all of these in place. So we now have spreader grafts, we have septal extension grafts, we have Kayumala struts, we have Ehler contour grafts, which are really great. They're the ones which you actually don't mind having some curvature to. And then of course this is a dorsal onlay graft, and again this is the one that you can taper that we've shown before, and this shows the power of bringing those together to give you a very powerful augmentation of the dorsum. And the other thing that's important with this is that when you're done, you always should place the concave, when there's any concavity, you should place it down onto the dorsum. And when I place this down onto the dorsum, I suture it to the dorsum at the keystone area and distally, because if there's any warping, it'll just give you some fullness to the nose, not some deviation. So that's a very important point. And of course here we do the tapering too, like we talked about before. And we taper these edges. So we've shown the power of fresh frozen rib in all of these areas that you can use both in primary and secondary rhinoplasty and an ethnic rhinoplasty that are very, very useful. And we certainly hope that you use these